Well, thank you everyone for joining. We're just going to, we've got an exciting next 30 minutes on this IG Live that we're going to be doing. It's titled Elevating Community Voices from the Nutrition Dialogues. And I'm super excited to be on this. So as you know, my name's Paul Newnham. I am the CEO of the SDG Advocacy Hub, which is a proud mobilizing partner for the Nutrition Dialogues. And the Nutrition Dialogues were launched by World Vision International and 4SD. The Nutrition Dialogues foster an open and honest discussion about the challenges and opportunities to ensure good nutrition for all, while embracing diverse perspectives that inspire innovative solutions and ways of working. To help put a face to these discussions, we have three amazing guests joining today's IG Live, and we're going to be discussing their experience of hosting a dialogue, as well as share the learnings, takeaways, and insights. So I'm going to just get them in now. I can see some of them have already requested, and so let me see if I can add them all in. Let's bring them in. We've got people. Awesome. So let me welcome everyone. I'm just going to put a bit of an introduction to add you all into the conversation, but so great to have you with me today. And hopefully you can hear me. You can all hear? Yep. Good. Yep. Perfect. So let me first introduce Finian Ali, who is Nigeria's Scaling Up Nutrition Civil Society Network Youth Coordinator. Finian's a nutrition advocate with over 9 years experience working with local and international organizations to strengthen advocacy and galvanize youth voices and actions through dialogues to improve nutrition, particularly around minority and vulnerable populations. So welcome, Finian.
Thank you so much, Paul. It's a pleasure to be here.
Great to have you. And then dialing in from Ghana, we have Barbara. Barbara Asare is the campaigns coordinator at World Vision Ghana. Hi, Barbara. It's so great to have you with us.
Hi, Paul.
And then our third guest is Siamola Murundo, who is the Senior Associate of Policy and Advocacy at the Global Alliance for Improved Nutrition, or GAIN, as many people know it. And you're dialing in from Kenya. Siamola is a public health professional with a keen interest in food systems, nutrition, and climate action. So thank you for joining us. How are you?
Thank you. Thank you.
Good to have you. So if you're watching, and you please feel free to put into the chat into the comments where you're dialing in from. We hope to, once we've had a bit of a dialogue together, have some time for you to ask a couple of questions if the time allows. So also be thinking about what your questions are. But we would love you to also, let us know what you're thinking about the chat as we go. So the guests are also going to be looking at the chat, and they'll be able to maybe answer some questions as we go as well. It's great to have somebody here from Nigeria listening in, which is great. So the Nigerians are always in the house, and the Kenyans, which is good. So good to see. So let's dive in. Barbara, let me start with you. World Vision Ghana team have hosted 6 dialogues, 5 of which were children's workshops. How is malnutrition affecting communities in Ghana? And what barriers to good nutrition were identified and discussed by the children in the dialogues?
Thank you so much, Paul. Yes, so we had it in our communities, our area program that is community-based, where we had children telling us what they think about nutrition. So for them, they feel that all about nutrition is having a good meal that tastes nice in their mouth. That is what they express as good nutrition. So they were not so much of having the necessary nutritions or nutrients, but they were about the taste. But for them, they are saying that it's affecting their health and their growth and then their development. For them, some said that it is very difficult to concentrate in class when they go to school hungry. And the majority of them, most of them do not eat before going to school. So they always go and then wait for either lunch or the school feeding when there is one in their community. For them, they feel that when children are not able to be well fed, they are sick in their communities, they fall sick, they are not able to be active and contribute well in their communities. And then they also came up with issues such as myth and then food taboos in the communities. Food taboos in the community. So, for instance, in some communities, children are not given eggs and then meat because they feel that when you give them egg and meat, they will go and steal when they don't have access to it. So sometimes, so these are food taboos in the communities. These are social norms in the communities that affect children. They want to enjoy the best part of the meat, but unfortunately, because of this norm, some are denied meat and eggs. And then there's also, it came out through the dialogue with the children that there were gender aspects where even though the girls and the women have access to food, I mean, they cook the food and all that, but they end up with the least portions because the best portions are mostly given to the men, and then especially the fathers have the best parts when the children are given, whilst the children are given just some little portion just to deter them from stealing meat when they don't have access to it. So these are issues that came out through the children's dialogue that the children expressed to us.
Thanks.
Yeah, thank you, Paul.
Barbara. That's it's really insightful, and I think the role of dialogues to really bring out these voices and these issues is really critical, and really great to see how World Vision's bringing children into this mix. Nutrition is very much about taste and delicious flavors on the plate, but it's also important for us to think about these cultural norms, and they determine the perspective of the food and who can eat what food and the gender elements. And I think sometimes we maybe can miss these things if we're not listening. And so this dialogue is really critical. Finian, let me bring you in. You've announced hosting 7 dialogues, many to elevate the voices of children and young people in different areas of Nigeria, in Bachi, in Yalwa, Lafia. How did the youth voices in different areas speak to the impacts of malnutrition on their communities? And what solutions did they propose to overcome some of these challenges?
Thank you so much, Paul. Confirm you can hear me.
I can hear you great.
Excellent. So just to say that as of today, we've been able to conduct about 18 community dialogues as of today. And we are also hoping to share the report of this dialogue on the Nutrition Dialogue portal. One thing I would like to emphasize here is the willingness of young people to have this conversation and talk about how they are affected by malnutrition, and also propose the solutions that they feel within their own context and their own perspective is ideal. So from what we've seen in the field, it's been, kind of, one is a pathetic situation because of the reality, and then the other one is the obvious reflection of ignorance. Majority of the people that we've interacted with, the young people, we've actually focused on young people within our demography, and we've tried to engage them across the 6 geopolitical zones of the country. Part of the major things that have been highlighted, in fact, one of them that stood out for me principally is the fact that I never knew there was a correlation between malnutrition and sexual abuse and exploitation. But during the course of our community dialogue, one of the participants shared that because she's hungry, because she's not well fed, because she's malnourished, then she becomes, very much vulnerable to sexual exploitation. People have to tip her with a little amount of money, and then, they sexually abuse her. So for me, that was a very spectacular case. We've also had instances where we interacted with students, and they, highlight ignorance as one of the key challenges that helps to promote malnutrition, because majority of the young people are unaware. They don't take nutrition as something that is quite important, that should be prioritized. We have instances of inflation within the country and how it affected food prices. A couple of months ago, you could get something at 1,000 naira, and now the same thing, you are getting it at 5,000 naira. So our participants stated that parents these days are no longer looking at the quality of the food, rather they are looking at the quantity of the food.
Amazing.
They just want to make sure the child eats food, and not necessarily that the child eats a nutritious So that is already a very important, a very dicey situation.
Yeah.
Then in terms of the solution proposed, interestingly, young people are willing to get back to agriculture, to go into farming. They want to start farming, and then they are saying, because we are young, we can do it. All we need is the enabling environment, and people seedling give us crops. Let's get to the farm. But locally here, young people farming is not something that is promoted or encouraged. So maybe if government start prioritizing creating access for, supporting young people to get into agriculture, that would be
Yeah.
a big one for them. Then
Yeah.
secondly, they are recommending, because of the similarity of the issues, that one, there should be compulsorily school garden in secondary schools and in primary school, so that from the moment that the child start getting into school, the child become exposed that what you eat, you shouldn't just be a consumer, you should also be a producer of what you are eating. So from school, they start farming, they start, appreciating school garden. One other thing they highlighted is that they want the government and also even people around to prioritize labeling of foods, because they feel that because foods are not properly labeled, and then the nutritional value of food are not also properly labeled, it predisposes one to consume, to abuse this food in excess. For example, beverages, they expect that a beverage bottle should have what is the normal amount that should be taken by an adult, in a day, this amount, and how many is contained in this bottle, so that the
Yeah.
person taking this is informed, may not need to abuse the drink, 2 bottles, 3 bottles, so on. So
Yeah.
let me just stop for now. Thank you so
Yeah,
much, Paul.
no, I mean, it's fascinating. And I mean, I think this is, it's amazing that you guys have done 18 dialogues. That's really impressive. And it's no wonder you've got a lot to say, because you've had a lot of conversation, and the insights are strong, which is great. It's so vital to have young people's voices at the heart of these nutrition and agricultural conversations, because there's so much insight and depth that's brought in there. And, even as you were speaking, this kind of theme around, just parents who are just trying to get enough food, or the right, they're not looking at the nutrition or the quality of the food. I think that's key. I think the links between malnutrition and the vulnerability to sexual abuse, or the effects of food prices on the quality of the food that people can buy and eat, I think these are all very important for people to be addressing as we're looking at interventions that can take in. And I think the proposed solutions around youth being both a consumer and a producer to encourage youth in agriculture, and the growing of school gardens is another really critical view. So really, really great to hear. If you are just dialing in and listening in, please feel free to also put in the chat where you're dialing in from. We also would love your questions. We'll hopefully have some space for that shortly, but it's good to see a broad range of people from around the world dialing in. So over to you, Siamola, in Nairobi, where the Global Alliance for Improved Nutrition colleagues hosted a dialogue with adults. What barriers and solutions were discussed in that nutrition dialogue?
Yeah, thank you for having me, and I think it's a good opportunity, of course, to discuss the dialogue component around discussion. So, of course, there are various barriers that were discussed, of course, related to access to that, and that is one of the challenges around the different towns that we have in the country. Is a bit of the issue around a bit of delivery of services around food is also one of the challenges that we discussed. But then, of course, the issue of malnutrition in Kenya standing rate stands at 18%. That's based on the of the Kenya Demographic Health Survey that was conducted in 2022. We have a 5% wasting at the moment, and I think also there are other issues and drivers that are contributing to this as major barriers, you can say. And one thing that I want to highlight as major barriers is, of course, we have very good policies and strategies that informs implementation of policy related to nutrition. But again, the slow pace of implementation of these policies and strategies, especially the community to be able to engage on this aspect around the national conversation and even sub-national conversation around policy related nutrition. Politically, of course, course, as part of the opportunity that we have, the current regime government that is already in place really prioritize food and nutrition security as one of the major commitments as part of the political commitment under the what we call the bottom-up economic transformation agenda. And of course, nutrition is being dived in as an agenda to, of course, addressing issues related to non-communicable diseases, as a major aspect also to be able to, of course, improve the performance of children. But that, of course, at the subnational level, another opportunity exists around the school feeding program that Kenya is really prioritizing within the subnational government that we have. We are working through a devolution government, and that is one of the key opportunities whereby we could get reports around improved performance of children, in terms of even the school dropout. Some of the reasons, because most of the children are able to go to school to access food, and of course, even the terms of performance was also improved based on reports that we're getting. But again, there's still a gap around the population is big and the population is increasing. The census report of 2019 reports that we were 47 million. At the moment, we are getting to 50 plus million at the moment. So probably maybe in the next census, the population is increasing day and night, and that means that, of course, we could have more resources related to human resource subjecting to nutrition, so that at least in a certain number of population that are being served, then there's always a one or two who are able to, of course, engage. And then the last point is some intervention around strengthening the capacity of communities to be able to, of course, engage in this conversation, especially decision makers and the private sector. As key players, engaging in policy. Maybe I can.
Yeah, no, thanks, Siamola. It's great to hear of Kenya's political leadership to improve food security and nutrition with school feeding programs to help access nutritious food in the face of this growing population. And then to really see how they're building communities' resilience and strengthening the role of food system actors is really critical to this action as well. I see that we have a question in there for you as well around gender inequalities and sexual exploitation intersections around the malnutrition theme. Do you want to say a comment just on that as well?
Great, thank you so much. So the bit of it is that the project is, of course, now empowering these women to be able to improve consumption and of course, really an important aspect that be able to address other issues related to malnutrition to most of the population. But also, again, we make sure that women are able to engage in decision-making processes and to be able to address the issue around aspect. It's one of the strategic areas around the new strategic plan that we have in the Kenyan office for GAIN, and is a bit of also addressing issues on gender equity and empowerment, and of course some aspect of economic aspect. So the bit of it is that the issue related to gender parities and other aspect that comes with the gender, they are so much important. And we have a policy in Kenya which is called the Women Economic Empowerment Strategy. There's a document that's contributing to the national gender and development policy. And we are so much cognizant around that area so that, again, we're able to strengthen those vulnerable and marginalized population to be able to engage in this process. So finalize on that is a bit of, we are cognizant that those issues, of course, are rising, but of course, with the various interventions around food and nutrition security, and then there's an opportunity that working through with the government and working with other players, private sector, development organizations, then there's that opportunity whereby we're able to empower and strengthen those community-based and the CSO organization to amplify change around those areas. I believe that's
great. Yeah, no, absolutely. And I mean, if you've got other thoughts, put them into the comments. Maybe just write something. Barbara, I might come to you. There's a question also on what connections have you observed between malnutrition and vulnerability around sexual abuse, and how can nutrition programs help protect children and youth in such contexts?
Okay, so mostly what happened from what we have from our communities, now children are seeing that it's difficult to have 3 square. Hello, can I be heard,
Yes,
Paul?
you can be
Yeah,
heard
it's
well.
so it's
Yeah.
difficult to afford 3 square meals a day.
Mm,
So what happens is most of them sometimes even engage in relationships where they get food to eat from people. I mean, people give them money for food. Out of hunger, they seek relationships, sexual relationships, just to be fed. And then
mm,
also one result is also from one causes of hunger is issue of child marriage. That
mm.
is when there's famine, when there's no land, when there's famine, when there's not enough, the girls are usually given out in exchange for food. That is something that happens. So
Yeah.
so for instance, this year we had droughts because of the
Mm,
erratic rainfall and all that. So the rainfall patterns could not be detailed. So the farmers had issues with
Mm,
their crops failing and all that. So in
yeah.
times like this, when there was less harvest, the girls really suffer because they are given out in exchange of marriage and all that for food items, for livestock and all that. So these
Yeah.
are some of the relationship between hunger and then that. So they may seek relationship just to be fed, just to
Yeah.
fulfill, yes, a desire to be filled with food and all that. In exchange for food, they may offer they may have relationships and all that. So these are some of the factors. And even children also said that the effects of hunger sometimes leads to child labor because they go and work in farms just to earn something, so just to get
Yeah.
food to eat to satisfy their hunger. They may be involved in child labor and all other things that come with it, child protection issues that come with hunger.
Yeah. Yeah.
And then the issues of abuse too is high because when crops fail, parents angry and all that, there are lots of issues of physical abuse, emotional abuse and all that, and especially with the girls, when they are the period of puberty, they need to have iron rich meals. So when they don't have it affects their menstrual flow and everything about them. So these are the issues of abuse, issues of child marriage, child labor are all related to hunger and malnutrition in the communities.
Yeah. No, absolutely. I mean, I think these intersections, it's really interesting as you have had these dialogues to hear about some of these
Yeah.
intersections from people. And I think the key thing is, it's so insightful to have these learnings and reflections, I think, through the nutrition dialogues, hearing from children, from vulnerable communities, from people working at the front lines around what's going on. And I think this is the importance of these dialogues. And we really celebrate the work that you're also doing in leading these dialogues. It's not easy, but you're listening and you're engaging, and this is really, really critical. I know this has been a quite a great discussion. It's insightful to really hear a lot of the learnings and reflections from all of your respective dialogues. I think it's really important, just as we come to the end, I've got maybe for one short intervention, and maybe we'll go to you, Finian, first. What tip would you give others who want to host a dialogue? What would you say to them?
yeah, thank you so much, Paul. So, one tip I would give is that I would encourage the convener to be very intentional about the conversation that he or she wants to have. Because when you are intentional, then it helps you to decide on who your participant would be, whether you need to bring together young people within a specific age. Because in my own dialogue, I've interacted with different stakeholders within the youth demographic, including
Yeah,
adolescent girls with disabilities, adolescent girls that are pregnant and also
yeah,
going for antenatal. So depending on the topic you want to discuss, then it will also inform who you are engaging with. And
amazing.
it is also important because it helps you to streamline and know what you want to achieve
Yeah,
from the dialogue you plan to hold. So it is very important that from the onset that you are intentional. One thing I would also like to share is that what I'm doing here in Nigeria is also happening, in over 20 countries where the some CSN is implementing the Youth Leader for Nutrition
Amazing.
program. Colleagues are also doing this in Kenya, in the Philippines, in Tanzania, and 20 other countries aside from Nigeria, and that's big. And these dialogues are not just done by myself alone in Nigeria. We have over 103 youth advocates
Amazing.
in the country who are leading this dialogue themselves. So because
Yeah.
they have been trained, their capacity have been built, and we
Yeah.
want them to also lead the process to galvanize and mobilize the voices of young people so that our voices can be heard. Oftentimes we feel our voices are not heard,
Yeah.
and it makes us feel like the people who are programming to solve our problem would not get it right.
Yeah.
There are very many instances like that that we generated from our dialogue where young
Yeah.
people feel that policies of government,
Yeah.
activities of government are not yielding result because they are not consulted, and it's so terrible because even
Mm.
within the development space, you see high NGO,
Mm.
international organization, designing programs without consulting the most affected population,
Yeah.
and that's not going to work. It's not
Yeah.
going to work. So including as simple as developing IYCF, in fact, and young child feeding counseling cards. You still need young people because they are the future parents. They are the one getting into adulthood to become mothers, to get pregnant. So you need to prioritize engagement with young
Yeah.
people so that we can, also inform the programming, development, and implementation. So my one tip is be intentional, be passionate
Yeah.
about the whole thing, and you will get the result. Thank you.
That's great. I know we're at time, and I really appreciate that intentionality. And it's great to also just recognize, you have World Vision here, Sun Civil Society Network, GAIN, and these are organizations which are being intentional to listen to and create space for dialogue around nutrition, so that that can be then taken to the highest level. It can be represented in to government, can be heard, and be informing, I guess, things like the Nutrition for Growth Summit and other interventions to ensure that they're effective, to ensure that they're being targeting the right places. So I know as of this morning, there's 128 nutrition dialogues that have been announced across the globe in 33 countries, from Peru to Mozambique, from Ireland to Papua New Guinea. We've heard from Barbara, from Siamola and Finian. These dialogues are critical opportunities to call for more ambitious and coordinated action by governments, donors, and civil society for improved nutrition. And there's still a month left for others to step up and host their own. So if you are interested in doing that, we really encourage you, head to the nutritiondialogues.org to learn more. And we will also share this, and I'm sure we'll tag all of the speakers. So reach out online if there's questions, because I'm sure each of you would be very happy to give some advice, to have even a dialogue on how to host the dialogue. But it's really important that we're listening and that we're hearing. And so thank you to the team. A big shout out to all of the mobilization partners, but also to World Vision and 4SD for really igniting and initiating this effort in the first place, to really think about the role of dialogue in really hearing from people and driving forward. So thank you, everyone. Thank you, each of you, for joining, and we'll look forward to hearing more. Maybe we can have another call in a few weeks and check back in on what else you're hearing, and what are some of those other insights. Thank you, everyone.
Thank you.
Thank you.
Thank you.